Okay, now come.
So if someone has a suspected ACL injury, you need to go through the toe taps procedure. So the first procedure is talk. So firstly you need to ask the patient what happened.
I went to go change direction and my knee gave out.
Did you feel anything?
Yeah, in my knee.
So it hurts in your knee?
Yeah.
Did you hear anything?
No, but I felt a pop.
Right. These are common symptoms of an ACL injury. Next you need to observe the injured area. In this case it's the knee. You need to look for deformities or swelling. So what you're going to do is you're going to compare it to the other knee and see if you can see any swelling. And in an ACL injury there'll be a lot of swelling around the injured site. The next stage is touch. So first you need to ask for the player's consent. Do you give me permission to touch your knee?
Yes.
Alright. You should feel around the injured area to further identify any swollen areas, deformities or areas of pain. So what you're going to do is you're going to start further away from the knee and move closer. And it should get to a point where they feel pain. So tell me when you feel pain.
Now.
Alright, and then coming from this side?
Now.
Alright. The player will be feeling a lot of pain around their knee area, so you're going to have to be careful. Active movement involves the player moving the injured limb and their surrounding joints. So for an ACL injury, you could get them to do flexion and extension at the knee. So I'm going to get you to do some flexion and extension at your knee, just until it, yeah. Okay, perfect. Do you feel pain in that?
Yes.
This can help observe players' range of motion and any pain in their knee. The next stage is passive movement, which involves a trainer or a qualified first aid person to provide the movement. An ACL test can be done to determine whether the player has torn their ACL or not. This test is called the Lockman test, and it is a clinical test which helps diagnose an ACL injury. It involves the patient laying flat and bending their knee at around 20 to 30 degrees. The examiner then stabilises the thigh and pulls the shin backwards with an slight external rotation. This places stress on the ACL. If the ACL is torn, then it will present more movement and a less stable endpoint. If players have passed all previous stages, the next stage is a skills test. It determines whether a player can return to play or not. The skills test should relate to the sport and the skills that the sport requires. And it also should relate to the injury, to test whether the injury is stable enough to return to play. For an ACL injury, you should get them to do a series of tests that correspond to changing of direction and things that put stress on the ACL. You can also get them to do some one-on-one tackles to see if they have any pain in the joint or not. If the player passes these tests, then they should be allowed to return to play. You should get the player to do some simple agility tests, like this one. By weaving around the cones, it replicates the movement of changing direction in a soccer game. Do that. Okay, next up. Hopping tests the stability of the knee and will not mask the ACL injury. If the player passes all of these tests, they should be allowed to return to play.